Hello, I'm Faustina Gomez, a technical officer on water sanitation and climate change in WHO's Southeast Asia Regional Office. Welcome to Module 3 of our course, Undertake an Assessment of the Facility. In this module, you'll learn to conduct thorough evaluations and adapt and align assessments with different contexts, national standards, and local needs. We'll introduce efficient data collection methods with tools like Excel and Kobo Toolbox. Additionally, we'll cover integrating gender, equality, and disability considerations. Our goal is to prepare you for inclusive and effective evaluations of a healthcare facility's WASH services. As a reminder, we are working our way through the WASH with cycle and are now on the second step, undertake an assessment of the facility. In step 2 of the WASH with improvement cycle, we conduct a detailed assessment of the facility. Before doing so, you must adapt the assessment form to the facility's unique context and needs and align it with national standards. An assessment should be conducted at baseline, then every 6 to 12 months. This allows you to compare assessments and see progress over time. Key tasks of this step include customizing the form, regularly conducting assessments to establish a baseline, and tracking progress over time. We use tools like a customizable assessment form in Excel for data collection and analysis and Kobo Toolbox for online assessments. These tools make data collection, analysis, and storage more efficient and time-saving. The assessment form serves as a comprehensive tool for evaluating adherence to WASH standards, encompassing over 90 indicators across 7 domains. As a reminder, these are water, sanitation, healthcare waste, hand hygiene, environmental cleaning, energy and environment, and facility management. The form can be used in Excel and Kobo Toolbox. Guidance on using Kobo Toolbox is available in the reference section of this module, including a video. It's important to note that not all indicators will apply universally, as their relevance varies depending on the facility type and service level. Indicators are categorized as essential or advanced. Indicators that are essential should be calculated by all facilities regardless of their size or location. These data can be used to calculate service levels, which can contribute to JMP national service level estimates. Not all indicators will need to be measured at each assessment, meaning subsequent assessments will be quicker than the initial in-depth assessment. Indicators are scored according to 3 levels: meeting minimum standards, partially meeting standards, or not meeting standards, shown here in green, yellow, and red. These contribute to the facility's overall score, measured as a percentage. The idea is that facilities should make incremental improvements to work their way up to meeting minimum standards. Alternative scoring systems can be used if preferred. An example of how indicators are scored is shown here. This one is on waste segregation. Adapting the WASH with assessment tool begins at the national level under the leadership of the Ministry of Health. This ensures alignment with national standards and applicability across various facility types and service levels. The Ministry will approve the final adapted version with the expectation that all facilities and partners use a standardized form. If you're starting to use WashWith, check with the Ministry of Health or WHO and UNICEF colleagues whether there is already a nationally approved version of the tool that you should be using. Strategies for adaptation include aligning indicators with national standards on wash, waste, and energy, modifying scoring criteria to suit different facility levels, adding new indicators for additional areas of interest, such as indicators from the WHO IPCAF, the Infection Prevention and Control Assessment Framework, and reducing the number of indicators for smaller facilities. Some facilities may wish to only focus on one of the 7 domains to start with, or only the essential indicators. Guidance on adaptation, including translations and local terminology, is available in the WashWith Guide Annex 2, which you can download from the reference section of this module. Let's take a look at an example from Mali with an approach to simplifying the WashWith assessment for smaller facilities, particularly those in rural areas with extremely limited resources and capacity. Recognizing that the full set of over 90 indicators was overwhelming for these smaller facilities, which have limited staff, resources, and indeed patience, the number of indicators was reduced by half. This made the assessment more manageable and relevant to the facility's specific context. Additionally, to aid understanding and implementation, locally drawn illustrations were used, effectively communicating what needed to be done in a clear and culturally resonant manner, especially useful for those with limited literacy. You can also start the washpit process in one ward or department, particularly with those with clear needs and motivated staff, before expanding to the full facility. This can help identify poor performing wards. These more targeted assessments will help you to allocate resources more efficiently. Take care to note that you should assess certain indicators repeatedly, example once for each area, and find the average. As well, specific departments or wards may require tailored indicators specific to their needs. For hospitals and larger facilities, labor, delivery, and neonatal departments often provide significant opportunities to improve quality of care, especially given the critical role of hygiene during child delivery. In general, hospitals and bigger facilities include more indicators. How do we pay particular attention to the needs of vulnerable groups in the washpit assessment? The washpit assessment requires you check the availability of gender-specific facilities and infrastructure, including solutions for toilets and menstrual hygiene management or MHM, the accessibility of drinking water, toilets and showers, including access paths, and gets you to think about how people with disabilities use and will benefit from the facility. Special attention should be given to critical areas such as delivery rooms, neonatal care units, and postnatal care rooms. Engaging in conversations with healthcare workers and facility management is crucial to identify and address any discriminatory attitudes or practices. It's important to acknowledge that power imbalances may prevent some staff from openly discussing issues. For a deeper understanding of these topics, refer to Module 12 of this course on Gender Equality, Disability and Social Inclusion, or GEDSI, or take the Open WHO course, Mainstreaming of Gender Equality, Disability and Social Inclusion in WASH and Healthcare Facilities. The washpit facility score offers a broad overview of a facility's overall condition. The score can be calculated for the whole facility, for a particular ward in a bigger facility, or a domain, for example, water or sanitation. The score also facilitates progress tracking and enables comparisons between different facilities. While the score can be a useful tool for tracking progress over time, it's important to note that the score is a relatively crude measure as all indicators carry the same weighting. This means an overall increase in the score might not reflect improvements across all indicators. A critical indicator which has a large impact, for example, availability of an improved water supply, may get worse while the overall score remains the same or improves. The significance of the score and the determination of cutoff points for evaluation should be tailored to specific needs and agreed upon either at the national level or by the facility's washpit team. For facilities scoring above 75%, performance is good, but improvements are still needed. Scores between 67 to 75% indicate average performance with additional efforts required. Scores below 67% reflect poor quality of care, necessitating major improvements. Let's look at an example from Kenya. There, the washpit score was used to conduct a comparative analysis across 16 district hospitals. This analysis focused on the percentage of indicators scoring 0, 1, or 2 within 4 key domains, which the chart on the screen shows. The results highlighted water as the highest scoring domain, providing valuable insights for government officials and policymakers to benchmark facility performance. Such data visualization not only facilitates comparison between facilities, but also motivates staff towards consistent improvement by clearly illustrating areas of strength and those requiring attention. More complicated data visualization can be done using online software such as Power BI. Thank you for reaching the end of this module. Key points include: the process begins with a comprehensive assessment of the facility, guiding all subsequent phases. A facility's performance is evaluated through a washpit score, offering an overall picture. The assessment identifies where gaps and challenges lie. Sharing the assessment results with relevant stakeholders is crucial. It's recommended to repeat the assessment and monitor progress every 6 to 12 months for continuous improvement. Please explore the reference section of this module to access links to all the resources mentioned.